Have you ever felt burning or pain while passing urine? That uncomfortable sensation is medically called dysuria. But did you know, dysuria is not a disease itself, it's a symptom of an underlying problem? Today, we'll understand what dysuria means, its causes, warning signs, diagnosis, and treatment in simple medical terms. Stethoscope. What is dysuria? Dysuria is the medical term used to describe pain, burning, or discomfort during urination. It usually indicates inflammation somewhere in the lower urinary tract, which includes the urethra, bladder, and in men, the prostate. It is commonly associated with urinary tract infections, UTIs, but can also occur due to several other reasons. Important point: dysuria is a symptom, not a disease. Magnifying glass tilted right. Common symptoms of dysuria. Patients may experience burning sensation while urinating. Patients may experience stinging or itching feeling. Pain at the beginning or end of urination. Increased frequency of urination. Urgency to pass urine. Lower abdominal discomfort. Now let's understand what different timing of pain indicates. Stopwatch pain based on timing. Heavy checkmark. Pain at the beginning of urination usually suggests a problem in the urethra, such as urethritis. Heavy checkmark. Pain at the end of urination, stranguria, often indicates bladder inflammation or prostate involvement. Heavy checkmark. Persistent pain throughout urination, commonly seen in infections or severe inflammation. Warning: most common causes of dysuria. Keycap 1. Urinary tract infection, UTI. The most common cause, especially in women. The bacteria most frequently responsible is Escherichia coli. UTI symptoms include burning urination. Frequent urination. Cloudy or foul-smelling urine. Sometimes fever. Sexually transmitted diseases. Infections like chlamydia, gonorrhea. These can cause urethral inflammation leading to painful urination, especially in sexually active individuals. Keycap 3. Prostate conditions. In men, prostatitis. Benign prostatic hyperplasia. Enlarged or inflamed prostate can cause burning urination along with weak urinary stream and incomplete bladder emptying. Sometimes, the cause is not infection but chemical irritation from soaps, bubble baths, scented hygiene products. These can inflame the urethra and cause temporary dysuria. Keycap 5. Other causes. Kidney stones, bladder tumors, interstitial cystitis. Though less common, these should be considered if symptoms persist. Test tube diagnosis. Doctors usually perform heavy checkmark urinalysis to detect bacteria, white blood cells, blood, or protein. Heavy checkmark urine culture to identify the exact bacteria. Heavy checkmark STI testing if needed. Heavy checkmark ultrasound or imaging in recurrent cases. Early diagnosis helps prevent complications. Treatment depends entirely on the cause. Bacterial infection. Antibiotics. STI-specific antimicrobial therapy. Prostate problems. Anti-inflammatory or alpha blockers. Irritant-related dysuria. Avoid the triggering product. Kidney stones. Pain management and stone removal. Important advice: never self-medicate with antibiotics without medical consultation. Police car light when to seek medical help. Consult a doctor immediately if you experience fever, blood in urine, severe lower abdominal pain, back pain, persistent symptoms more than 2 to 3 days. Direct hit. Conclusion: dysuria is a warning sign. It commonly indicates infection, irritation, or inflammation in the urinary tract. Early diagnosis and proper treatment are essential to avoid complications. If you found this explanation helpful, like the video, subscribe to the channel, and comment below which medical topic you want next.